Welcome to BARI Banter, where we talk everything bariatric surgery with the people that know it best, the patients. I'm Shannon, and I'm here with my co-hostess with the mostest,
Lita. So sit back, relax, and remember, sip, sip, sip.
Welcome back to another episode of BARI Banter, Lita. I'm just going to fix that up. Let's start this episode off. I want to ask you the question of the week, which is, what would you rate your knowledge of nutrition out of 10?
Like right now, or
Like right now. Yeah, right now.
Probably like a 5 or 6.
5 or 6? Okay. And what would have it been prior to surgery?
Probably like a 3 or 4.
Did you think you knew more than you knew back then?
No,
Like,
I think I know more now. Does that make sense? Like,
yeah, you got there eventually. Yeah, I get what you mean. Because I think I'm similar. Like
Yeah.
it's like as much as you keep learning, you sometimes I think you know more than you
Yeah.
think you know. And I think it's about kind of, and that's why I say drop the ego, because it's like sometimes just saying I don't know gives you a chance to learn more.
Yeah.
Because if you start going, oh, I know everything, you've like put these walls up of like not learning things. And I did that a lot in the past. And like, because I reckon before I started surgery, I thought, oh, I knew food. I was probably a 5 or 6. But now I look like now and I've learned a lot over this process. But I still think I'm like a 5 or 6.
well, see, I think before surgery, I thought that there was like good food, bad food. There was like you need to eat healthy foods and eat less of the unhealthy foods. But since surgery, like I still believe that, but there's a lot more to food than just good and bad. Which, yeah, it's so I kind of like I understand that you're meant to eat more of the healthy foods, but healthy foods don't necessarily mean healthy foods.
Yeah.
You know what I mean?
Yeah.
Like it
is.
just,
And also
it's very
understanding
complex.
how the body processes things.
Yeah.
Like that's been something that's been really interesting for me, because like even in the past I've been like, oh yeah, I know what BCAAs are. And then people would be like, what does it even stand for? And I was like, I don't know. It's BCAAs. You take it like when you work out, not understanding like, what the amino acids and stuff actually do in your body and how it processes and stuff like that. So it's been interesting. I guess being friends with Amy, who is studying to be a nutritionist, and having these conversations frequently, it kind of goes, wow, I really knew nothing.
But it's
when it came
also
to that
like
stuff.
one thing that I've learned is that it's different for everybody as well, because your body's processed in different ways, and like depending on what you're doing at the time. Like I always thought carbs and sugar were bad. Like, stay away from them. Don't eat bread, don't eat pasta, don't eat, you know what I mean? But like if you are, for instance, training to do something like a long distance race or something like that, then carbs aren't necessarily
Well, no, they're
bad.
not. They're
Like,
not the devil. Like,
yeah.
like depends on how
how your body processes it and
stuff
how
like
you're
that.
there's just, and I think that if I was to sit here and say, oh yeah, my understanding of nutrition is like an 8 or 9, I'd be like,
I think it's why I've stopped giving advice to other bariatric patients. Like, people go, what do you eat? And blah, blah. I said, this is what I eat, but I recommend sitting down with an expert to discuss what's best for you, because we're all very different and complex, and different exercises need different fuels and stuff like that. Because I know I got overweight for a reason, and I haven't put the time into understanding it enough to be like, I'm confident in my answer to give this to you. But someone who would be confident about giving us an answer, because they have gone through the processes and do understand it in a more detail, is our guest today. So without further ado, let's bring her on and have a chat.
So today's guest not only had the bypass in 2017, she's also a clinical nutritionalist that specialises in bariatric nutrition. 5 years down the track, she's managed to maintain a loss of roughly 60 kilos and completely overhauled her relationship with food, and also had a successful pregnancy in that time as well. Here to talk to us about her journey, please welcome the honest, inspired and successful Carrie, also known as biome.integrative.nutrition on Instagram.
That's a mouthful. Welcome to the podcast. Thank you for joining us.
Yeah, good morning. Good morning. Happy to be here.
Happy to be here. So you becoming a nutritionist, was this something you did after surgery? Is it something, a passion you found and you've pursued it? Like how far after surgery did you kind of start heading down this direction?
I actually started the journey before I had surgery.
Oh, wow.
So I had years and years of gastrointestinal pain, couldn't, go to the toilet properly, constant back pain, and doctors were just saying it's this, it's that, the other. You're going to have your gallbladder out, your intestines don't move properly. And just as a result of that, I wanted to follow the path of trying to figure out my own health. So I enrolled in doing clinical nutrition as a means of finding my own answers, because I wasn't getting any through mainstream medicine.
Yeah.
And it got to the point where it didn't matter what I ate. So I was following all the tips and everything that I was learning, and I was just gaining more weight. So it was a combination of both all of the things that the doctors were telling me was wrong with my body and trying to find a nutritional plan that will fit me. And then I went down the path of having bariatric surgery about halfway through my degree. Wow. So I then changed my scope when I in my learning and focused it more towards bariatrics from then on.
That would have been a really helpful thing to have, like that knowledge leading into bariatric surgery. But then also, like anything, it takes longer than 2 years to learn something. So I'm assuming throughout this process you've learned. Do you feel like you've learned a lot through living it?
Oh, absolutely. I think without having had the surgery, I wouldn't be qualified to be able to give the advice that I give. I think that's an essential part of being somebody in either nutrition or dietetics that is helping people post-surgery, that they have to have some sort of lived experience in it because, hands down, one of the biggest things that comes back to me from clients is that the dietitian just doesn't get it, or they didn't give me the information that was suited to me, or they're just not listening to what I'm telling them about my body, or I can't get that amount in that they're telling me to eat. So it's a very difficult situation, and knowing that I have that experience and knowing full well that I know it's hard right now and what we can do and figure it out, it works wonders with people. Yeah,
because it's one thing to understand the nutritional side of things. It's another thing to understand the behavioural side of things. So like coming from your background, you understand that like you can tell someone to have a food, but then there's also the behavioural side of it where it's like, certain things are triggers and stuff like that. Have you found that, that's been an interesting side to understand?
Oh yeah, actually. So that's one of the main parts of my role. So, I mean, if you check out my bio, it says I'm a clinical nutritionist, but I've also gone into counselling as well. So I'm a food behaviour counsellor as well. So we actually work on the behaviours and food relationships first and foremost because my catchphrase is the problem is never the problem. It's never about the food, really. So we start from the beginning. What was the catalyst to all of this? And it sometimes it goes really far back. So, long-standing habitual behaviours that have been developed from childhood that we don't actually realise and don't think of that insidious until we get ourselves to a point where we're on that surgical table going, there's no other option here.
Yeah. Your catchphrase sounds a lot like my catchphrase. Mine's we're all fucked, just some people hide it better than others.
But can I ask for... Like, I don't really know the difference, and sorry if this is like a offensive question to ask you or not, but what's the difference between a dietitian and a nutritionalist?
Offensive.
No, it's not offensive. It's just one of those. It's just one of those things. Okay, so basically the degrees are almost identical. So a clinical nutritionist. So I did a degree in nutrition and dietetic medicine, and a dietitian would have to do a nutrition degree. Now, a dietetic nutrition degree is very bookwork, whereas mine had a clinical component where I actually did over 300 hours of face-to-face clinical training. Like, young doctors and nurses do training face-to-face until they get registered. So that's one difference. The second difference is that my degree is based more in integrative and holistic complementary allied health. So it is a full picture, more patient-focused, individualised scope of practice, whereas dietetics is more public health-based. And then the main difference is that dietetics is covered by AHPRA, which is the medical board, whereas clinical nutritionists are private practice.
Wow, okay.
And then you get into
So if you've got a reputable clinical nutritionist that's registered by all their affiliated bodies, they're pretty much on par.
Yeah.
So.
And then you can get into the realm of like, sports nutritionists and other, like, I guess you're a bariatric nutritionist, and then there's a whole like different category for all that kind of stuff as well, because it goes into different realms in that aspect
you're
too.
You're not narrowed by There are certain rules and generic standards when it comes to aftercare and treatment protocol for, say, for instance, surgery. There is a standard which is a generic standard for public health. So everybody gets their handout that says you must meet 60 grams of protein and you must have this and you must have that. And everybody gets that because that's the standard within the tertiary medical system. Whereas a clinical nutritionist can say, okay, well, based on them guidelines and then considering your individual factors, we're going to change this up and give you something else that's specified for you. So we're not narrowed by that those guidelines. We can actually work independently and individually with people.
Wow. So you seem like someone who really takes the time to understand things and, like, I guess, fact checks a lot of stuff. You went the bypass route over the sleeve. What was your reasoning behind that? Was that led by investigation, or your surgeon kind of led you that way? What was your decision making behind that?
So my decision making was twofold. The first one was weight loss outcomes for bypass versus sleeve. I also wanted something that could be potentially reversible should my problems persist. So the weight loss outcomes were higher for bypass, even in the long term. I was looking long term perspective. So it's a sad fact that, through my research and my future research, which I'm going to be going into, is that a lot of people do end up regaining weight after bariatric surgery, and it might be from no fault of their own. It might be for anatomical reasons or what have you, but within 5 years after surgery, a lot of people do regain the weight. So I did choose to go down bypass because it had a lower regain percentage as that. It was also reversible, and I also had reflux and other gastrointestinal issues, which it just seemed a more appropriate fit for me.
And that was RNY or mini? Did you go?
RNY.
RNY.
Have you since having surgery, like you said, one of your main reasons for having the surgery was because of your digestive issues. Since having the surgery, has that helped it? Have you sort of come further with your digestion?
About 10%.
Oh, no.
It didn't actually help so I have had certain parts of gastroparesis, so certain bits didn't move, intestinal cramping and things like that. So it hasn't actually resolved that completely, but I have since figured out what the problem was, which wasn't associated to my digestive system at all. So, yeah, funny that after surgery figured it out, but it turned out that it was just spinal nerves getting pinched, and because nerves all attached to your stomach and your intestines and all of that, the innervation of my intestines basically was impeded by that.
Wow.
So spinal health is very important.
Yeah.
Whoa, the body never stops to
it's a complex little beast.
Thinking what you just said then, because of your spine, it was making your intestines not work properly. It's crazy. It blows my mind.
Absolutely. And that's the most amazing thing about what I do, is because people will come in and say, you know what, I've had this surgery. Yeah, I've lost weight, but now I'm tired and I'm feeling depressed, and I just don't feel like I should, or I think that I should. And I'm like, okay, well let's take a look at what are you eating? What's going on in your life? Are you getting enough sleep? Are you drinking enough water? Yeah, I'm getting enough sleep. I'm getting enough water. Why do I still feel like crap? Okay, let's go a little bit further. What are your symptoms? Do you have particularly smelly gas? Do you have, all of this kind of stuff? We go down that path, and then they're like, yeah, I do. Are you sensitive to smells? Yeah, okay. Well, and then from there we're like, okay, well, your gut's out of whack. So you've got an imbalance in your gut bacteria, something like that. And we would do testing and so on to confirm that. But people don't realize that surgery changes that internal structure and that internal environment, and that impacts absolutely everything from your feel-good hormone production, so your neurotransmitters, to the way that you process chemicals, the way you process drugs and additives and all of that stuff. And that in turn feeds into every other aspect of your life, from your sleep to your energy to your mood.
Well, it's true that song, the hip bone's connected to the knee bone. It's like everything is connected in some way or another. It's quite crazy.
So you said going into surgery, it was to fix not just physical pain, but your emotional pain. What do you mean by that?
Look, we all have a story of, what kind of led us to surgery and the kind of feelings surrounding that. And I don't think anybody that's been obese for a long period of their life can honestly say that they were happy with themselves or happy in their life. So it was one of those things that I had to really dig deep and see that there was a lot of emotional pain, a lot of emotional trauma associated with the way I felt about myself, my perceptions of myself, and how those were triggering me down a path of my own physical self-destruction that kind of led me to surgery. It wasn't just the physical pain I wanted to remove. It was emotional pain as well, how much I hated myself and how I looked.
And does that come down to, like, I guess, your perception of how you didn't fit the mold of society? Was it kind of in that aspect of, like, you know? Oh,
yeah.
Yeah.
Absolutely. I mean, and I think it was a little bit of a skewed perception in many respects. Coming, you know, being where I am now and the way that I see things now, and a lot of work that I've gone into, you know, reshaping and relearning behaviours and getting to the crux of all of this, you know, it was a little bit skewed, but I did feel that, you know, that smaller people got all the breaks. You know, I wasn't seen as effective enough as other people or capable enough because obviously, you know, being fat means you're stupid, apparently.
Yeah.
You know, that's how it felt to me. It wasn't necessarily the case, but that's how I felt, and I think that's what I projected out to other people, especially in my studies as well. You know, I was petrified. I was absolutely petrified because I sat there and I thought, why am I even studying all of this? Because who's going to come and see a fat nutritionist? You know, it's like you never trust a skinny chef, right? You know?
Yeah, no, exactly.
So who's going to come to me? But in that, you know, it took a lot of soul searching to realize that, you know what, more people will come to me having been through that because I've lived it and I understand how hard it actually is. I can't just, you know, you can't just give somebody a diet and say, hey, follow this. See you later.
Yeah.
You know, you've got to say, what are the barriers that are getting in your way? You know, what are your strengths that are going to help you succeed? What are your motivators? And really tap into all of that stuff. And, you know, more effectively is, what do you enjoy eating? You know, that's another thing that's really just ignored. What do you enjoy eating? Because food is enjoyment as well. We shouldn't, you know, hate it the moment that we have surgery.
Yeah. And I think because, like, one of those things that you just touched on then, which I've talked to Amy about, my friend who is starting to be a nutritionist as well, is kind of like I've been to a lot of dietitians and nutritionists over my time through my bariatric process. And if I had have stopped at like the first two that I met, I would have been like, oh, no, you know, no, they're not for me kind of thing. But it's about kind of finding one that works with you, like with you and for you. Because I know I've had like, I think, you know, two of my whole thing. I've probably seen like 8, 2 that actually I enjoyed talking to, and that made me kind of absorb the information they're giving. Because like some people, you go in and you feel so they feel so cold and stiff. You kind of just go in with this kind of like, I'm about to be taught. You know, you're not going to have a conversation. Like they kind of do it in a way that almost feels like they're not humanizing what they're teaching. And I think what you were just saying, which I think is really important, is because you've been there, I think you would understand that. And that's a conversation I've been having with Amy lately where I'm like, you've got to develop as much as you've got to develop your, like the knowledge she has, because clearly, you know, to get to the level you guys are at, you have the knowledge, but you've also got to try and put it away across in a way that people will absorb that information. And that's something like, Amy, I've been kind of like, every time we run, she's been trying to story tell to me. Because I always say, like, that's how I get taught, is I need to be engaged in the conversation. Otherwise, I have a bit of ADHD, so I'll waffle off if I lose interest. So I've always got to be involved and stimulated through the conversation to absorb the information. And, you know, I think for you, you going through this process, I'm sure you're going to develop systems to understand that not everyone's going to be taught the same way. And you've got to find those ways to get that knowledge across.
But I think it's also a massive thing too, though, because you have gone through the process. People will, like you, as you said, you understand it. Like when I used to work at the surgery, there were so many people that they'd come in and they'd be closed-minded because they're kind of like, well, here's the surgeon. He knows what he has to tell me. And then you've got the psychologists and the dietitians, and what would they know? Like they've just read out of a book and they know what to tell me, but they've never gone through what I've gone through.
Yeah.
And then like having myself working there, it was almost like a sigh of relief when people were kind of like, oh, well, there is somebody in here who has gone through the process and knows what I'm going through. So I just feel like
automatically puts the walls down,
automatically,
you know?
It kind of just like almost lifts the weight off people's shoulders to kind of be like, oh, well, it's not just her reading something out of a textbook being like, no, you need to eat this or you need to follow this. Like it's a massive, like I think that's a huge advantage.
Yeah, step in the right direction.
Yeah.
You absolutely have to meet people where they're at and, you know, understand that a lot of time, and I'm not saying in all cases because there are some people that genuinely get surgery because they physically don't have any other option and it's got no emotional aspect to it whatsoever. But in a lot of cases, there's some really deep-seated, food trauma type situation going on there. Food being used as coping mechanisms and stress relief and all of that. And people haven't actually developed those the emotional resilience to not use food as those tools. And it's never getting addressed in this process. So I think it is really important to meet people where they're at and understand that it's not just a matter of eat this and you'll lose weight.
Yeah. And I think as well, like going in to talk to someone like a nutritionist, you go in, like you kind of just hit it before where you were saying like when you're bigger, you presume to be dumb, you presume to be not know a lot. So like you get put in a situation where you're sitting down with a nutritionist who is kind of like the peak of the educational food world. You know what I mean? Like it's kind of like they understand food to a level that they must be successful. So being a bigger person and sitting down in the room with someone that intimidating from that level automatically sets you up to kind of like, have your walls up, have your guard up, and then probably not, take a lot away from that experience.
It is. It just compounds those social stigmas against being overweight. You walk into a room already defeated because you failed.
Yeah.
And then you have somebody that's never lived it tell you how you're still failing. That it is. It's demoralizing. It's so absolutely demoralizing. I have clients that come in and they teeter up and down a few kilos and they feel like an absolute failure. And I'm like, okay, well, no, it's not a failure. You're trying. Every time you try, it's not a failure. Let's see how we can take you that step further. What is it that's tripping you up? And then again, it's not about the food.
Yeah.
Talking to you and like reading through the forms that you filled out before coming on the show, it's very apparent that you're very switched on and you are well aware of the fact that the surgery was just a tool and that there's a lot of things that you need to work on prior to like the success story essentially. Was this something that you knew going into surgery, or is this something that you've sort of developed now looking back over the last 5 years?
A bit of both. I mean, the culmination of it has been a learning journey for me over the last 5 years. But leading into it, there was that understanding that, again, it wasn't about food for me wholly and solely. I was feeding pain. I was feeding emotions. I was feeding both physical and mental trauma that I put on myself. I was feeding depression and anxiety, so I knew that those were solutions that didn't match the problem. And I had to find solutions that matched those problems. Food was just going to be part of that journey, So I've got that now. It's so I look at it in terms of addiction, in a lot of ways. Like, not that we're addicted to food, but trying to reshape food behaviors can be likened to addiction in so many ways. But it's one of the most hardest ones to change because it's a constant in your life. It's something that you're constantly surrounded by. You can't go cold turkey from food. You
say that all the time.
That's just, it's in your face all the time. So of course there's always going to be that constant struggle unless you look at why you're struggling.
Yeah. Something I want to ask you is, obviously you've done really well. It sounds like you've developed a lot of tools in your arsenal, but would you sit there and still say you have issues you're working on? Because obviously you're 5 years out. So from where you started to where you are now, you've come a hell of a long way. But like I kind of say it all the time, like it took 30 years to ingrain a lot of these habits. They're still going to be there 3, 4, 5, 6, 7 years down the track. Are you still having to work on certain things in your lifestyle?
Absolutely. It's constantly changing, and then I'm constantly learning as well. I am human. I fall down to stress. I fall down to overworking and overburden and fall in that trap of not getting enough sleep and underfueling myself, or overfueling when the time arises.
Yeah.
I'm human, but with all the tools that I've developed and everything that I've done, I've turned it into a more healthy experience that doesn't last the week or the month or the 6 months or the year. It's the one-time event. If I want to engage in eating or drinking or whatever it is, a social event that involves food, I'll do that. But I leave it where it lies. I don't continue it on, and I don't take guilt with it. And that was a big driver before, like, let's stuff it. You've already stuffed your diet up. Let's just
blow it all the way.
Yeah, that's
yeah.
it.
For it.
Just let it go. Because something you said in the form, which I found really interesting as well, you said the biggest fear going into surgery was that the issues would still be there after
the real
surgery.
issues.
The real issues.
Yeah.
You know, what were these issues you were talking about?
So for me, it was a sense of not feeling valid within myself, not feeling worthwhile, not feeling valued as a person. You know, I would look around and I was so angry. I was a very angry person, and I would always project and blame others. Oh, it's your fault. It's your fault that I feel this way. You're the one that's judging me. You know, you're the one that doesn't like me because I'm fat. You know, and always blaming that. When it came down to it, you know, I lacked that soul drive and that purpose and that understanding of myself. You know, I was trying to seek validation to feel good about myself, but I was asking the wrong people for that validation.
Yeah.
I should have been asking myself.
Yeah. Oh, yeah. That amen to that, because it is. And sometimes the validation we require has to come from within, not exterior. And that's kind of like with Instagram, we talked about it before. I think a lot of people use that as their way to get their validation without understanding that, like, sometimes you put too much emphasis on that validation, and then that takes the validation from within away, because you're not giving it to yourself, you're getting it from other people. So yeah, amen to that. I think that's a very good thing to focus on, definitely after surgery.
And how are you dealing, like, how are you coping with that now? Like, how are you going? Do you find, like, obviously your work, you'd feel a lot of validation and you'd feel that, you know, you're getting a lot of appreciation for what you're doing. But, like, on a personal level, have you, like, do you value yourself now, like, outside of a work environment?
Absolutely. I could say as early as maybe 2.5 years out, it was a bit of a tricky stage in the first couple of years as your body goes through those dynamic changes and you see all the shifts and you're like, what the hell's going on with my body? Oh my God. You know, I felt more comfortable when it was inflated. Now I can honestly say I can stand there stark naked in front of the mirror with the skin, with the changes, and go, you know what, you are phenomenal. You know, you are I love the skin that I'm in. I wouldn't change a bit. You know, people do go get surgery. That's for plastic surgery afterwards, and that's on, you know, their choice, and that's fantastic if that's going to help them. But I look in the mirror now and go, you know what, you're fantastic. And I used to hate myself. I used to think that I was the lowest of the low.
Yeah.
You know, no one will ever love you. No one, you look at you, you're horrible. You know, I just look in the mirror now and just, you know what, you're great. And I know that sounds very self-serving and very, you know, full of myself, but that's not it at all. I'm just truly appreciating that I'm a human that's gone through so much stuff that I've put on myself. A lot of it has been self-inflicted because of a very skewed understanding of what I thought society expected of me. And now I'm like, no, actually, the only opinion that matters now is mine. What feels good for me in my soul and my heart. You know, that's the opinion that matters.
I find it really interesting when people do that. Like, so you just kind of like talked yourself up and like said nice things about yourself, but then you automatically followed it up with like, but it's not to like, you know, you kind of like defended like, because it's funny, if you put yourself on a pedestal and you build yourself up, you automatically are assumed to be like egotistical or like stuck up or up yourself and blah blah blah. But it's a good thing to have. Like, you know, you shouldn't have to worry about other people feeling like you like yourself too much. And it's just, I find it really funny that society does that to you.
I know.
Yeah.
I know, but it's the flip side of the coin, isn't it? So I apologise for being overweight. Now I apologise for feeling great.
I know.
Yeah,
you know,
I know.
It's funny though, because if someone was to walk away from like a conversation with you and then go and talk about you behind their back, and the only thing they have to say about you is, "Oh my God, she loves herself too much." Like, is that a bad thing? Like, oh my God, she got so much self-worth. I can't deal with this. Like,
but that's been like the main philosophy with like after surgery, like is believing, because I always self-doubted, always said, I can't do that, I can't do that, I can't do that. And then as soon as I turned that coin, I started saying, I can do that, and had that positive focus on things would happen. And then you would be like, oh, it's because I'm skinny. No, it's because you actually started believing in yourself, and like you didn't have this negative self-talk.
You got rid of the imposter syndrome and just walked into belief. That's the main thing. When you say that you can, you absolutely can.
That's it. What's the expression? Whether you say you can or you can't, you're right.
Yeah.
It's like, it's so true. Like having a positive outlook and a positive focus will eventually give you what you want. It's like, it's a funny little situation. You obviously, being after surgery, you've had.
It's a fine line.
Yeah,
we're cutting each other off.
Oh no, that's all right. Yeah, Yeah, no, it is. And I think you're right. It is a fine line, but it's also like, I think you just said it multiple times where your main focus should be what you feel about yourself within. And it's very, in a very external world that we live in where everything's on social media, we're projecting certain things and da-da-da-da. Sometimes we can rely on others to tell us what we should feel about ourselves, where it's like, if you just kind of take a step back and focus on you, good things will come from that.
Yeah, I think because people don't realise that the moment they do that, the quality that they do give to others improves.
Mm.
You know, so if your main focus is, for instance, I hear a lot, so I just do so much for other people. I'm constantly fixing other people's problems and doing that, and leave no room for myself and leave no time for myself. I'm at the bottom of the list. Everybody else comes first. And I said to a client yesterday, if somebody half-assed a job for you, would you be happy with that? So you want to be putting your whole life into something, right?
Yeah.
And if that's your main focus is taking care of your family, do you want to half-ass it or do you want to whole-ass it? She's like, oh, okay, I get that. I'm like, well, that means that you need to put that back into you first. Because it's that whole filling a cup from an empty one scenario. You just can't do it.
Yeah. I've also found too, there's been a lot of people that I've spoken to over the last couple of years, and they're kind of like, my friendships have changed so much since having bariatric surgery. And like, it comes down to a lot like that you have changed your lifestyle. So therefore you're interested in other things and stuff, but you also kind of just develop this, like, as you said, full ass or half ass sort of attitude. Like, I don't want to spend time with people who, like, let's face it, a lot of the time some of my friends were just friends with me because they could ridicule me, or it made them feel better because, they were fitter than me, they were healthier than me, and that, that sort of thing. And then over time I went, you know what, I don't have to put up with this anymore. Like, my friendship with you was just you putting me down constantly, and I've realized that now, and I'm done with that sort of thing. Like, so it just comes back again, you lose friendships, you lose different things because you start valuing yourself and you start valuing the people and the things that you have in your own life.
Yeah, you identify what starts to matter in your life with that, like what Shannon was saying, with the positivity. When you start to believe that you can, and then that moves into I am, then you realize that a lot of the things that were happening before don't align now.
Yeah.
So things fall away by the wayside. And I think it's fantastic seeing people go through that process where they just become their true selves, the self that's been in there that whole time that they were just too scared to let out because of that perception of ridicule or perception of judgment. So just moving into that and just shedding the skin, so to speak.
It's almost like when you have bariatric surgery, your food becomes quality over quantity, but I think your whole life becomes quality over quantity, rather than wanting more, and you just focus on like good value and things, and people and the relationships you have around you. And it's always going to be a transition if because I think important fact of this process is you can't expect change if you're not willing to change. And it doesn't just mean yourself, it means the environment you live in needs to change in order to be successful after bariatric surgery. Something else we need to congratulate you on is becoming a mother after bariatric surgery. How long after surgery?
I was a mother before.
Oh, you were? Oh, leader, fact check.
I had a baby before surgery, and I had an IVF baby after surgery.
Okay, you're right. Sorry. There's she was a mother before. We
Sorry.
just obviously missed that.
A new mum. You became another new mum.
So talk us through that. So you went through IVF. How long after surgery did that whole process kick off?
So I had my first baby 6 months before I had the surgery. So that was really good to actually see, the contrast between a pre-surgical baby and a post-surgical baby. And I've got a 5-year-old and a 2-year-old. My youngest is 2, so 3 years in, so 2.5, 3 years in, I went through the process of IVF, and it was, both were fertility treatment babies. So. The difference was astounding. It took 5 tries the first time round, and it happened on the first time this time round, the second time round after surgery. So everything improved after that. The whole process was fantastic. I felt the best I'd ever felt in my life, being pregnant at a healthy weight, eating for my body. Just absolutely fantastic. hardly gained any weight because I was just eating instinctually and intuitively. And luckily, both of my babies came a little bit early, so that was nice from my
Thanks, guys. Thanks for
just quietly, and I am putting it out there into the ether, but they both have quite big heads.
Something for you to look forward to later.
I was going to say, Shan has a really big head, and and I have a tiny head, so I'm like, I just really hope the baby follows after me with my tiny little head, so that
I don't want to have my eyes, my smile. I just want to have my skull structure.
Do they think?
Yes, I was quite lucky. They came early.
Leading into the pregnancy with the IVF the second time round, was there any concerns that the IVF clinic that you went through, did they sort of have any concerns because you had the bypass with the malnourishment and all that sort of thing?
No, they weren't concerned really at all. They said that basically you would just need to go through your normal antenatal care and make sure that everything's tracked accordingly. My GP was good with that and just made note that I'd had bypass and there may be issues. So we just scheduled more regular pathology to make sure that my iron levels and everything were on point. I ended up having, I'm one of those lucky people that doesn't absorb iron very well by ingesting. So I have to get iron infusion. So we just made sure that I had a preemptive one before going into the process and maintained my supplementation during the pregnancy. But there was no concerns about risks or growth restrictions or anything like that. And I think it's still a relatively new field as well. So they put a little bit more focus on you, but not so much as there's worry and risk, and so many people now are having babies post-surgically and there's no real risks highlighted. It's just make sure you eat.
Sure you're doing it doing it right. So your story, your IVF story, I saw it ended up in a newspaper somewhere in WA, was it? Why did it make the newspaper?
They were just looking for reached out and asked about my experience of working with people that had IVF, and I said actually I hadn't. They just wanted stories from women that had gone through the IVF process and what it was like, and so it was just a personal story.
It wasn't because
notable.
It wasn't because there was any complications or it was
no.
That's really good.
I think it kind of aligned with the IVF process being actually covered by Medicare in a few clinics, so the rollout of that, I think it was aligning with the government trend at the time.
What was, for you going through both, again, I love that you did the market research of having a baby prior to surgery and then one after surgery, just to be fully informed. But what was some of the big things that differed between the two? Obviously you felt healthier and stuff as you stated before, but was there anything else that kind of you went, wow, that's different this time around?
Yeah, so the first time round, I had just started, I was in my first year of my studies. I was working in a call centre, so it was not a very strenuous job. And I ended up having to leave that job within the first 3 months of my pregnancy just to chronic fatigue, stress, anxiety, all of that. I mean, call centre environments aren't very nice anyway, but it was just too much for me. I didn't have energy. I felt very lethargic, sick, sore, which they said, it was fibromyalgia, but I don't have any of that anymore, so I'm not sure what it was, but I was just struggling. Now, the second baby, I was doing studies, I was working, and I was pretty much on my feet until I was 7 months pregnant. So, and that was, I gave birth, 7 months, 8 months pregnant, 8 months, 1 week. So I was pretty much straight up until my, delivery date working, no fatigue, had heaps of energy. I was going for bike rides. I was still going to the gym in the early stages, all of that stuff. Nothing kind of changed. I was just growing something, I still felt energized and invigorated. And it was a very stark difference between the two, from feeling like absolute crap, like your body is being drained, even though you're eating more and can eat more, versus Now I'm restricted and I'm feeling energized, not drained.
I think that says probably a lot about your mindsets at the time too. I think when you were bigger, you were kind of using, oh, I'm pregnant, so I don't have to do things. Where the second time around, you were like, I'm pregnant, it's not going to stop me from doing things. Because sometimes, you know, we can use things as an excuse and like take, because we always, as I've said before, we always look for the path of least resistance. So it's always like we always want to be comfortable. It's kind of like a human instinct. But if you take a mindset of like, no, I have things I want to achieve, and that little bit of effort's worth that energy, you know, you go and do it. Where if you go, oh, well, no, that takes more energy, I'm just going to sit back here because it takes no energy. So I think a lot of that sounds like it was to do with your mindset at the time too.
Oh, absolutely. Absolutely. I mean, there was a lot of that. I just don't want to be here. I hate this job. You know, there was a lot of that going on in there, but the physical aspect of it as well was the biggest difference. You know, carrying the extra weight, feeling so tired, not being able to just do daily things. You know, it was easier just to sit on the couch and, you know, snack. It was easier to do those things. But yeah, I've never seen pregnancy as a, you know, some people see it as an illness. You know, it's just a condition you're in at this present point in time. It shouldn't be a hindrance unless there is a medical need for you to rest, kind of thing. So I just got on with it.
Did you gain weight during your first pregnancy before surgery?
Yeah, I did. Not a lot. I started off at 123. And by the end of my pregnancy, I was at my highest weight of 131.
Yep.
And I kind of stayed there until my pre-op. Got down to 123 again before surgery.
Yeah.
With my second pregnancy, I gained baby weight and nothing more. So once he was born, I was back down to my pre-pregnancy weight.
Oh, wow. That just goes to show, you know, you were fueling and keeping on track with like your life that you could create.
I was just growing him.
Yeah, literally, you're just growing your life inside
your
you.
body was doing what it was made to do.
You make it sound like you so underrate it. It's like just growing a life over here, you know, just moving on.
Just doing the do, you know.
So talk us about what's next for you. You know, how are you planning to continue helping people on their journeys? And, you know, do you have further education and different things you're going to pursue or?
Absolutely. And you've just, my brain's just gone ping because this is my passion area now.
Puts down the car.
I love learning. It's what drives me, and understanding, you know, what people need and being able to give them that is my driving factor. So at this present point in time, because of my experience, and I've recognized that there is a need for multimodal care when it comes to post-bariatric surgery, the aftercare model. So, you go to see your surgeon, you get 6 follow-ups or so approximately that gets you to that 12-week post-op period. Then you kind of left alone. You get a psychological appointment beforehand to see whether or not you're fit to go under the knife. And sometimes you might get a follow-up, sometimes not. And then you get maybe half a dozen dietitian appointments with their selected dietitian, and that's it. And then most people fly blind from there. For me, I think that it should be a whole, fully encompassed process. So it is my aim to change that process altogether and include psychological support as part of that aftercare model as standard. So I've just finished my bridging course in clinical psychology, and I'm moving into the pathway process to do clinical psychology. Hopefully in the next 5 years, I will be known as Dr. Carrie.
Oh, that's cool.
Yeah. So, and I want to change that process because when we look at the long-term statistics, and I don't say this to scare anybody listening, because, if your mindset's in the right place, and just keep focusing on that, you will succeed. But there is a lot of regain, and that regain isn't about food choice a lot of the time. It's about life. What's happening when life happens? What choices do you make when life happens? And helping people, develop better strategies and mechanisms around coping when life happens outside of food. So finding strategies that match, so making that the standard of care. I think that's really important.
Love it.
Well, I think I was thinking as you were saying that, I'm like, you're a person I will definitely want to stay in touch with, because Alita and I have talked about it as well, the after processes of bariatric surgery. And I literally just saw my surgeon and had conversation with him trying to get the ball rolling on a few things, because we also believe that, you know, the aftercare is where I guess the failures are happening. The surgery they've got down, like they've knuckled it down, you know, that they know how to slice and dice us perfectly and get us in and get us out. But I do believe that, you know, sitting down with a bariatric nutritionist and dietitian works for some, doesn't work for all. And I have said I would love to create a system and implement it where it's done with an expert, but in a group setting, where you're more likely, when you're sitting down in a group atmosphere, all it takes is one person opening up, and then the floodgates open, you know what I mean? Because I think a lot of the times we go into that with a very tense mentality of just like, I'm going to tell them what they want to hear, you know, like where if you go in and it all takes one person to be like, blah, 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 and then someone goes, oh my God, I relate to that. I did this, or, you know, and then you get more healing from that, because I know sometimes like there's been things that I've held in for years and years and years from, you know, childhood and different things, that as soon as I put it out and I verbalized it, the soothing, like the healing process starts. Because you bottle it up and you hold it in, or you don't externalize it, sometimes it takes you out from within. So I think, you know, getting someone in a situation like that after with a psychologist or dietitian or nutritionist or whoever it is, and having that conversation can sometimes really get the ball moving in the right direction. So,
but like, how many times as well have you heard of people being like, oh, I've got my appointment with my surgeon in 2 weeks, or I've got my appointment with my dietitian in 2 weeks. So they kind of like clean up their act a little bit for those 2 weeks leading into those appointments.
Oh yeah.
It's kind of like, well, you know, what you do in those 2 weeks doesn't necessarily change the outcome of your whole life, sort of thing. So we kind of want to, you know, if you're in a group environment and you're probably just going to say things accidentally, like word vomit, and just because other people are saying them, and you're kind of like, oh yeah, no, well, if you're saying that, I'll be honest with myself too, and you know, I do that as well, sort of thing. You're more likely to open up and be honest if other people are sort of going through the same thing as well. So yeah,
absolutely. And I mean, I experienced that firsthand. I mean, I run a little Facebook group for support based on it, so people just filter in when they want. But I do, you know, live webinars and workshops and things like that. And one of the particular ones that I did was a 5-day disarming the trigger challenge thing. And it started by, you've got to look deep in yourself and have a look at what is actually triggering you to have these behaviors. Where do they stem from? Can you find the root cause of them? You know, do you know where this has come from? You know, what's tripping you up and all of that, and then helping people develop strategies, you know, just in that small scale 5-day thing, not, you know, fully intense work, but, you know, can we develop at least one strategy for one trigger and help you move forward from there, and then you can apply that process from there. And then from that, when, you know, just through talking about certain things and giving examples of certain triggers and where they might have come from, you know, people flood in and go, oh wow, that happened to me, and now I can see the connection. Oh, I can see that I've done that. Wow, mind blown. Okay, I never thought of it like that. And it just takes that one little seed for someone to then go, yeah, I'm ready to make some change.
Yeah.
You know, just offering that opportunity.
Yeah.
Because I think it comes down to perception too sometimes, because like we can both have the same situation, but someone will see it different to another. Like the thing that comes to my mind when you're saying that is like, you know, me and my sister have both lived a very similar life, but as a child, and I saw it one way where she saw it another way. And we also, you know, afterwards went 2 different ways with how we dealt with it. And I think, you know, you pretty much summed it up then when you were saying like, you know, all it takes is someone to be like, oh, I had this experience and I saw it like this, and this is how it transpired for me. And then someone goes, oh, I had the same experience, but I didn't see it like that, but now I'm seeing what you're saying. And then they kind of go, okay, now I can move past it and start working on that. So yeah, I think, you know, we are all, like, especially the bariatric community, we all have a lot of similarities, but we're very different. But that's what we found with BARI Banter is like, you know, someone will sit down and they'll tell their process. And yes, not everyone's going to register with every part of everyone's process, but all it takes is one little thing from someone's podcast that someone goes, they said this, and wow, that really helped me, or that really, you know, showed me the light to a degree of, you know, where things have been unrolling for me. And so I think we're all kind of like each other's tools to a degree to kind of keep moving
the
forward.
Connection and the support is really important. And, you know, if you find it's somebody that resonates with you in any respect, hold on to them with both hands and just go with it. Because if that's a motivating factor for you, fantastic.
Take
Do
it. Yeah.
Use it.
That's why I've kept Lita around. No.
On a personal level, thanks, Sean.
Yeah.
On a personal level, though, goals for you personally outside of business development and growing that way. Do you have any sort of like, you know, personal goals that you want to achieve in the next sort of year or so?
I'm wanting to buy a house. Not that I think I would be able to, but I've got it in my mind.
That's it.
Yep.
Like I'm going to buy a house. I'm visually thinking here, you know, law of attraction, all of that sort of stuff.
Yep.
No, my personal goals are all centered around what I do because that's my
Passion.
That's my joy. Drinking. Yeah, that's what fills me up. So, you know, to me, it's not work. You know, I quite often do pro bono stuff because I just genuinely want to help. And yeah, just to offer more to people and let them know that they're not alone with things that they think they're alone with. That's all I kind of hope for. You know, before that I was just floundering. Like I didn't know what I wanted to do. Now I do. I'm just holding on to it and I'm doing it.
Wow, that's cool.
Opening up, giving advice and comfort. It's a great way to be. Is there anything in your bariatric process that you would have done differently looking back?
No.
No?
No, I see, I'm one of those people that looks at it and goes, I had to go down this path for a reason. I faced the hurdles I faced because there were learning experiences for me. You know, there's no failures in my life now. They're all ways I can do things differently. Yep. They're all learning experiences. So maybe just, I don't know, finding a very plain whey protein to begin with and just sticking with that rather than trying all the different flavors.
But now you've tried them all, you can tell people what you like and what you don't like.
Yeah, and my favourites are just the easiest, most accessible supermarket varieties. They're fantastic, you know, because they're not full of all these weird flavors and claims and all of that. They're just unadulterated supermarket stuff. No, see, I'm all about making things work for people within their budget and what works for them, you know, in that respect. You know, there's lots of different barriers that we face, but yeah, I don't really have any. No,
I think that's a good
one.
Great,
I think that's
regret.
Because it's everything.
Because it's helped me shape my path now. So
yeah,
it came with its own lessons.
Yeah, absolutely.
Top tip for someone just starting out in this process, or like I guess something to be wary of taking this process.
Something to be wary of is, I know we've all heard it before, is the honeymoon period. Yeah, where the weight loss is fantastic. It drops off like lightning, and then you hit that 12-month mark and you're about 10 kilos away from your goal and you just can't seem to get there. And then slowly but surely that weight comes back on because the behaviours that you should have looked at prior to surgery start returning as well, because of whether it's the disappointment of the failure of the weight loss or whether it's just life getting back to normal because you're eating more regular portion sizes again. And, you know, because that 12-month mark, you know, your restriction isn't as what it was in the first few months. So, you know, being wary that what you take into it, you'll hold on to it unless you address it. So what you're taking into the surgery will still be there after 80% of your stomach's removed or your intestines are rerouted a metre in, and those issues will still be there. So just beware that, you know, things do change, and after surgery, yes, it's like, I like to use the analogy of antidepressants in the respect that, you know, you may have, you know, be suffering with depression or anxiety or mental health issues for a while, and you get prescribed antidepressants, and they alone will help you for a short amount of time, but then they will stop being as effective unless you have counselling support and stuff to work through the issues. They work as a dampener to help you work through the issues. Same thing goes for surgery. It works as a dampener to give you that opportunity and that freedom to work through those food issues and that until you get past that honeymoon period.
Yeah.
And hopefully you've done some of the work.
Yeah, because it is. That. Well, I think Lita had a quote about that once with the chauffeur, where like the chauffeur's driving you first year, and then the second year he gets out and he fills up the car every now and then and leaves you to your own devices. Third year he just kind of leaves you in the car and you have to deal with it yourself. So, you know, it's kind of like, yes, in that first year, the sleeve, because I've said that before, like people can lose 50, 60, 70, 80, 90 kilos and not deal like with the issues, you know, like because they could be just kind of on this, you know, the sleeves definitely or the bypass is assisting them to lose that weight. But then, you know, it covers up a lot of the issues and you think, oh, I've lost the weight, I'm fine now. And it's like, well, no, because those little magician tricks start coming out and going, ta-da, I'm still here, you know what I mean? Like now you got to deal with me, and it just slowly drip feeds back into your you know, life.
Everyday life, yeah.
And you have to deal with them.
Yeah, just on that, you know, the amount of people that come into my office and say, now I've lost all the weight and I still feel depressed.
Yeah.
You know, I don't know why I'm not happy. It's phenomenal. It's because the problem is never the problem. You know, the food was never the problem. The fat was never the problem. It was always something on the inside that you were trying to find a reason for.
Yeah.
You know, just trying to grasp that it was this. And now that the weight's gone, what is it? You know, are we gonna start keep on projecting and go, oh, it's now because I've got loose skin, or it's now because of this, or is it because of, like what I said in the beginning, that, you know, was I just trying to seek validation externally rather than internally? You know, what was it?
Yeah.
You know, and those things that you take into surgery, you take out with you as well.
Yeah. No, because that's like, I wouldn't sit here and say the weight made me happy. It was the things that losing the weight allowed me to achieve that has made me happy. Because if you put the whole stigma on losing the weight, that's where my happiness lies. And then you get there and you go, wait a second, I'm still miserable. I'm just as skinny and miserable. You know, that would come with its own very like.
But then you start chasing, all right, well, I've got loose skin. So if I get rid of my loose skin, that will make me happy.
That will make me happy,
And then, like, well, hang on, loose skin's gone now. I'll get fake boobs. That will make me happy. Like, I'll get Botox. I'll get, you know, like, where do you when you start draw the line?
Maybe
like,
my physical appearance isn't the issue.
Isn't the problem. Yeah.
Yeah. You know, and I'm glad that I made that realization early in the piece, that it was never about that. It was about so many other things, because, you know, I know I'm not the only person that's sat there and done this. You know, you've seen somebody that embodies your past self, you know, quite overweight or what have you, and they are the most confident, bubbly, you know, vivacious person with so much confidence. And you could think to yourself, well, why couldn't I have loved myself as much as them? You know, why are they so body confident? Why wasn't I? We were exactly the same. So it was how I felt about myself at that weight, or how I felt about my abilities at that weight.
Yeah.
You know, it wasn't the weight itself. And it just popped into mind, one other tip that I would give anybody going into surgery or after surgery is, sorry if you can hear that noise, is that focus on the goal action and not the goal. So all the little things that your goal means to you, you know, so when I lose the weight, I'm going to go horse riding, I'm going to go skydiving, I'm going to be, you know, start pole dancing, whatever those things in you that you just desperately want to do. Focus on the goal action and not the goal, how life looks, you know, feels, smells like, tastes like when you're at that goal. Focus on those things and not a weight number or where you'll be at the end, because if you wait for that, you're missing out on life.
So you mean like, so rather than focusing on like where your life needs to be when that goal's achieved, you focus on just getting to be able to do the action. So it's like, rather than like trying to sculpt a huge picture, you're just simplifying the process to say, this is what I want. Is that kind of what you were talking about?
Yeah. So like, I want my life to be, you know, fulfilled. I want my life to be, I want to be confident. I want to do this. So what are the actions I need to take to be and embody that goal?
Yeah.
Yeah. And that's, I'm going to get out there. I'm going to connect with more people. I'm going to learn. I'm going to just, you know, the whole, not fake it till you make it, but I'm just going to start embodying those aspects of myself that I want to be in the end, because you know, deep down, that's who you truly are.
Yeah.
It's like the steps in the ladder analogy that you always say. You want to get to the top of the ladder, but you've also got to take each step of like each run of the ladder at a time.
I'm a firm believer, and I used to always try and jump to the top of the mountain, but after reading Atomic Habits, I kind of went, no, you know what? That's where I've gone wrong in the past. I've always tried to jump straight to the top of the mountain rather than appreciating the steps to get there. Like, so sometimes just taking that first step is the most important step, because sometimes if the goal's too big, it feels overwhelming. Where if you just focus on like that first step right there, and then you just keep taking those one steps, eventually you get to the top of the mountain. You're like, I'm here. Wow, that was not as hard as I thought it was going to be. So yeah, no, I think it's the same concept. And I like, honestly, I've loved having this conversation with you because it's like so many things you've said that I'm just like, yes, oh my God, yes. And like a lot of things I've learned personally through just talking to you that you've kind of made my mind to kind of go, oh yeah, wow, I do see that. I understand that. If other people want to reach out to you and have similar conversations or sit down and have a chat with you about, you know, where they're at in their own process, what's the best way to reach out to you?
The easiest way to get in touch with me and just suss me out without actually having to make contact is just going to, because I know a lot of people are like that. We're like, I don't know whether or not
I'm going to stalk
going to fit. That's why I've got lots of videos and stuff on my page. But it's just my Facebook page, which is called Bariatric Success, Mind, Body, Belly. Okay. Because it's that whole, you know, heart, mind, soul, body kind of aspect, mind, body, belly.
Yeah. And
success.
And you got BioMe, which is obviously, we'll put that.
Biome. Yeah. Biome Integrative Nutrition.
Oh, got you. I keep saying biome.
Yeah, I was reading it the way that it's spelled, so sorry, biome.
No, it's fine. It's Biome Integrative Nutrition, yeah, so that's just .com.au.
Yep.
Yeah.
No, and if you just put biome nutrition in a Google search, you'll be able to find me as well.
What's the meaning behind what's the meaning behind biome?
Biome.
So biome is your intestinal environment, your gut biome.
Wow.
So all the little inner workings of yourself, because it's all interconnected. It's all a big jigsaw puzzle that, you know, one little area is not being supported, another one's failing. So,
oh my God,
that makes so much more sense than biome.
And this, nobody knows this, but I'm just going to be, you know, a little bit, let you in on something. If you see the little picture in the background, that's the chemical structure for serotonin.
Oh.
So it's just like, you know, so we will feel good through what we eat.
I love
Nobody
that.
knows that.
See, that's a well thought out. You should really. That's stimulating a leader right there.
Yeah. I have been looking. I have been looking at your logo behind your head the whole time, being like, okay.
That's what she does for a job. Yeah. So that's like her passion. That's where it lies.
Did you know that over 80% of our serotonin is made in the gut?
Oh.
And it's impacted. It is impacted after we have surgery, and especially when people start to limit their carbohydrates. When you were saying in the beginning, carbs aren't evil. No, you need them.
Yeah,
you absolutely need them. You need to feed that good gut bacteria and produce those feel-good hormones.
Well, that would explain why I went through severe depression after bariatric surgery. You know, it was a few weeks after surgery that I contemplated taking my own life, and it could have a lot to do with that. You know what I mean? Yeah. So, like, you know, it might have just been like my stomach was like, you've taken something away. Now I take something away from you. No. Anyway, that's one way to wrap up an episode. But it's been an absolute pleasure. I hope people get a lot from it, reach out to you, and get a little bit more knowledge, because you seem like an incredible part of the bariatric community and someone I know I'm very grateful to have in it. So thank you very much for sitting down with us today.
Thanks, Shannon. Thanks, Leda.
Thanks so much.
That is another episode of Bari
Banter.
Why, yes, that is another episode of Bari Banter in the books. We hope you got a little something from that one.
Head on over to Facebook or Instagram and check us out, or go to baribanter.com where you can watch past episodes, give us feedback, and let us know who you want to hear from next.
We love you all, and as always, please stay beautiful.